I think the most important part of the genomics as it relates to CMML or any other rare disease is that because it's so challenging to compel industry partners and perform clinical trials in the space, being able to repurpose therapies that may be approved for another type of disease or related disease that have a similar molecular profile that could work in CMML opens the door for our patients to have a larger toolbox that we can use to treat them that otherwise we wouldn't. And so the most practical way that we use it is that way. The second important thing is these mutations, like myeloproliferative diseases, like all diseases in the myeloid neoplasm space, mutations are very prognostic. And so we were part of a model or a part of the development of a model that we presented last ASH that leveraged both clinical, pathologic, and genetic data to devise a tool that we hope to be a standard for how we prognosticate and see.